workforce strategy beyond major health system, brought to you in partnership with AMN Healthcare. Before we begin, I would like to cover a few housekeeping items. As you can see at the bottom of your screen, a multiple application widget that you can use. All the widgets are resizable and movable, so please feel free to move them around. If you have any questions during the webinar, you can submit them to the Q&A widget. We'll try to answer as many questions as possible. However, if we run out of time, we'll make sure to answer to you by email. You can also click on the help widget to help you navigate the platform, and you can also click on the resource lists to add any PDF files, download any links that you might find useful. At this point, I will introduce our moderator for today. We have River Meisinger, VP of Enterprise Solution at AMN Healthcare Workwise. River, you can take the stand.
Very good. We're so pleased to be here and so incredibly excited today as we think of the topic, right? Modernizing workforce strategy beyond major health systems. River Meisinger, as was shared here at AMN within our enterprise, and really one of my favorite parts of the work we get to do on a day-to-day basis is to listen. And so as we think of this topic today, so incredibly excited to be joined by Susan, Don, Kimberly, and Andy. But really in the discussion we are having, right, of looking at where is workforce today within the health systems we see overall, but more specifically for these health systems and some of the representation we'll talk through the importance of regional health systems, right, community health systems, and the imperatives of making sure we are getting it right. And as we're talking through as a group, so excited to hear the brilliance and collaboration, maybe synergies, and as well as lessons learned when we think of topics like retention, like recruitment, acquisition, how we're making good strategic decisions, and ultimately how the generational workforce is shifting. These are conversations I get to hear on a day-to-day basis, but really excited to be surrounded and go through that dialogue. And I'm reminded once again, always from a friend who I've worked with for a long period of time, every single health system I get to spend time with, you know, when you've seen one system, you've seen one system. So both the ability to learn from each other, but also the ability then to individualize how does that work within your community, how does that work within your culture. Just very excited to be here. So starting today, I would love to turn it over to Susan to start with introductions. We'll go around and do that for all of us.
Sure, and thank you. I'm Susan Burroughs. I'm Chief Operating Officer here at Wilson Medical Center. We are a Duke LifePoint facility located in Eastern North Carolina. I oversee a broad portfolio of clinical and operational services, and much of my work today is really sitting at the intersection of workforce strategy, service line development, and operational transformation. And I'm excited to hear from my fellow panelists and answer any questions that our audience might have today. Thank you.
Very good, Susan, thank you. And then moving to Dawn, would love to have you introduce.
Good afternoon. Thank you very much. My name is Dawn Tice. I'm the Chief Operating Officer for Mount Nittany Health Physician Group, which is located in State College, Pennsylvania, somewhat of the center of the state. My core responsibilities are really leading the strategic efforts and implementation for the large medical specialty group, which comprise about 34 practices, 225 physicians and APPs. And our network is critical to services in this kind of rural community, by which it provides care both in the ambulatory setting as well as really takes the burden of the inpatient services as well. Very passionate to be here today. You know, the delivery of healthcare is a people business, people taking care of people. And, you know, being able to provide the kind of competent and quality and compassionate care really requires a very strong and skilled workforce. So looking forward to the conversation today.
Thank you, Dawn. Andy?
Yep. Thanks, River. Andy Tiehen. I'm the Associate Chief HR Officer here at Denver Health. I have been at this organization for 6.5 years. Denver Health is the safety net anchor institution for the city and community of Denver. And we're a fully integrated health system. So we have just shy of 9,000 employees with a level 1 trauma center, all types of specialty care. But we also have nearly 30 outpatient clinics around the region, including in school-based. We have the 911 paramedic call center, a foundation, and a medical plan. And so while we're known as the level 1 trauma center in Denver, we were founded and at our core are a community health system. We're here for the community, and that's a big part of our mission is serving our patients regardless of ability to pay. So my primary focus is running the HR teams, so the HR operations, and supporting the business with what our 2 core strategic priorities have been around engagement and retention. So how are we helping the organization attract the best talent, keep that talent, and keep a highly engaged and motivated workforce as a goal to become a best place to work. So very grateful to be here and looking forward to sharing insights and learning from the group as well.
Thank you, Andy. And rounding out with Kimber.
Hey, River, it's great to be here today. My name is Dr. Kimberly Hatchel. I am the Chief Operating Officer for Bronson Methodist Hospital, and I'm also one of the System Senior Vice Presidents for Bronson Healthcare Group in Kalamazoo, Michigan. I've been here for 4 years. Part of my system role is ensuring some of our regional growth, all of our strategy and growth for both the flagship hospital, but systems like radiology, lab, therapies across our 9-county region. We are the largest employer in Southwest Michigan, and that is something that I do not take lightly. So not only do we serve that 9-county region from a patient perspective, but we're also responsible for keeping a large number of our community members employed. And so understanding where healthcare is going, understanding how to keep our employees happy and landing on the right strategies is something that I feel really, really passionate about. I spent a good deal of my career, about 20 years, in progressive leadership, executive leadership at Hospital Corporation of America. So it's been a real pleasure to relocate to the Midwest and really dig in this community and serve in such a role here in this organization.
Thank you. What a great group. We're so excited and to get perspectives really across the nation here and or really Midwest to kind of the Southeast and covering really all sort of these perspectives. Starting with question number 1, and I'm sure right for each of you, so crucial in your day-to-day, as we think of workforce shortages, rising labor costs, competition that not only comes from your healthcare partners and or healthcare organizations regionally, but also now really non-healthcare employers. What strategies, maybe starting with you, Andy, have been most effective and or you're working through iterating and learning from around recruitment, not only recruitment, but retaining and engaging your workforce? And with those changes, right, both in all of those groups and then also generational workforce shifts, what are those ideas and or solutions are you starting with at Denver Health today?
Yeah, there's quite a few, but I'd say the most prominent one has probably been us leaning into leading with the engagement data as a leading indicator for how people are experiencing their work and how we're driving motivation and productivity in the employee experience. We, a couple years ago, switched over to Workday Peakon, which has provided us a tool that gives leaders real-time access to pulse surveys. So we started quarterly, now we're down to 3 times a year, but it gives them a dashboard that helps them get real-time insights into what's driving employee engagement and what are the things they can do to set focus areas and have real-time follow-up and action. Not only does it give the leaders that, it gives the organization access to say, where are there gap areas, what are the themes, and where can we deploy strategies? So our two lowest scores when we first started were reward and recognition. So we put together a great plan to say, what are we going to do to support leaders, and what are we doing as an organization to drive and improve reward and recognition? And we went to work doing a number of things. We created a Neo on-site experience so that all of our new hires really felt the impact and mission of the organization. We rolled out total reward statements and really focused on the employee value proposition. So, you know, everybody's common message is, I need more money, and pay is the driving factor. But there's a lot of things that go into what you get as an employee of an organization. And so really highlighting those, the total benefit package, rich retirement, access to quality healthcare with low medical premiums, and the career pathway navigation and access to employee wellness, as well as the why, which for us, being a mission-driven organization, a lot of people come to work here because of the mission, the opportunity to serve the patient population. And so harnessing all of that and equipping, I think importantly, equipping leaders with how to talk about it is what's most important, so that it's not just a singular or a narrow focus conversation. So I'd say that's been the main thing, is getting the tools in place that give you access to the information, but most importantly, helping develop leaders to take timely action and follow up on that effectively has probably been the biggest driver.
And knowing this great group, any builds on those?
Well, I could add. I'll jump in there. I'd say that we're doing a little something a little bit more intentionally, because it's not always about the recruitment, but really kind of focusing on retention. What can we do to get people to stay? Because we all know that once you lose a very seasoned employee, that it's a huge problem to really backfill that particular person. They've got all the history, the knowledge, and many of them have actually trained others around them and brought them up to speed. So also looking at some career pathways. This is something that one of our departments had shared in our last employee engagement survey. And I could see that former leader hadn't really taken any action on it. And so we're looking at building some career pathways, if you will. How do I, as a frontline staff member, become a lead? How do I become a manager? How do I become a director? And building in some of those things. Also being intentional about pipeline strategy, because we realize there's a shortage across the nation for many of the positions that we need, whether that's a tech or those filling in some of your ancillary and more ambulatory spaces. And so looking at one thing that we've done is really partnered with our community college here, Wilson Community College, and we're looking at implementing an apprenticeship program for surge techs. And so that was something that was brought to us by one of the former OR managers. She had actually done a lot of work around that with one of her previous organizations, and we thought it was great and thought we'd be able to replicate that and implement that here and begin to build our own pipeline. And I really like the collaboration with our local community college also. We instituted 2 scholarships for students to be able to participate, and support them through that journey. And one of the nice things I can share is we hosted some young people last year, I think it was, and one of the people one of the young folks have actually signed up and is going to actually benefit from one of those scholarships. So we can say that, oh, wow, we put some things in place. We're excited to see that it's working. People are taking advantage of it, and that we're also partnering with our partners in the community. So that's something I would add. Thank you.
River, I would say that most health systems, and again, you can see how innovative systems are around both recruitment and retention. We all have to work on both at the same time. And so even in recruitment right now, I think we've seen the advancement of sign-on bonuses where it's not just a sign-on bonus, but it's tied to retention, like trying to get them to get enculturated with you for 2 or 3 years to invest in your organization, give you more time to invest in them. We've been focused heavily on social media, digital campaigns, geofencing, trying to reach people in different markets to tell them that we're here. We still very much lean into social events like, coffee and, careers, right? Knowing that there's a total population that just wants to engage almost in like community of interest, and retention, very similar to my colleagues, really reimagining the employee survey. We have leaned away from kind of the more global 75 question survey that made it difficult to act upon into poll surveys. I think it definitely allowed us to provide the organization real-time feedback about how they were feeling, but also to provide real-time feedback about what we as leaders were doing about it. We combined that strategy with leadership rounding. All executives had to get out and round with frontline staff, coordinators, supervisors, managers, directors, so that we could understand and talk with them about the feedback that we had received. So that emphasis on the listening mechanisms became very important. And I think I'll touch on something that Andy said. It really just highlighted the need for us as an organization to double down on investing in frontline leaders and the retention of their staff.
Yeah, and I want to add on to this. All of my colleagues have said listening is an absolute strategy, right? And so we deploy something here called the Bronson Management Strategy, which is lean healthcare. And we do every unit and every department has a strategy A3 that we look at every single day, the leaders round every day, and we lean in and we ask questions. And we do that because we're leading across 5 generations. And as Andy said, what we're looking at is all 5 generations want different scheduling. No one wants to work nights anymore. And that is a national issue. It's not just here in Kalamazoo, Michigan, that's across the country. People want different benefits. That total rewards cannot be understated. And it's got to be in a menu format. It's got to be, I choose this and opt out of that. And that's really hard if you're an employer of size to be able to orchestrate and pull that together. And so, that's some of the things that we're doing as well.
So well said. Just maybe one takeaway in listening to each of you, right? No one answer. I love, Dawn, your thoughts on have to balance both. Great thoughts, right, Susan, coming from how do we find pipelines within our own community? I think resonating, listening to you both, Dawn and Kimberly, as we think of, getting out, reward and recognition, being engaged, listening, and Andy really starting us off right with also how do we make sure we're engaging through systems and process there too. Building on that, right? We have this world, right, where we see an aging population, we see a demand and change as we think of where will care best be delivered. Starting with you, Kimberly, at Bronson, as we think of the ambulatory specialty services, how to plan, right, and how to look at access, and maybe even thirdly within that, looking at capacity around that. How are your teams operationalizing that today? And then thinking about having to flex and or add premium labor to that in decisioning, how are your teams working to do that at Bronson today?
Yeah, there's so many things I want to say about this. At Bronson, we think care is best delivered locally. And so we're a 4-hospital system. I serve as the chief operating officer for the hospital that's in the center of the flagship, but we have a very important community hospital in Battle Creek. And then we have 2 critical access hospitals that serve on the Michigan Lakeshore to communities that would not have health care if we were there. So when we're thinking about delivering that ambulatory footprint and growing services like CT and MRI and those sort of things, we're trying to deliver the diagnostics in the local community and then pull the tertiary stuff in to the center. I think that's massively important. And when you look at things like radiology across the country, we could take MRI here in Michigan. We only produce 50 MRI techs a year in the entire state, right? And so when you're thinking about every hospital system is in hand-to-hand combat for those 50 people, you're having to create specialty programs to attract them. We do residencies here with our MRI students, and we're offering them a job before they're even learning their first protocol, right? And so that's very important. But those are the places that I think about getting the most value for my dollar when I think about contingent labor. If I'm able to, one CT scanner in our system will add 4,000 individual studies. And so for me, when I think about adding contingent labor or augmenting my regular staff, I think about also meeting the community need. So what is needed here? And we can see that need growing, as you said, because patients are becoming more complex. We're experiencing what's known as the great grain here in Michigan. And so we're having large percentages crossing over that age of 65. And so we see the demand for those ambulatory services continue to grow. We're also 100% full on our inpatient units, which really isn't going in line with what the industry said was going to be happening to us at this point. They said a lot of things would be going outpatient, and a lot of things are going outpatient. You see surgery shifting from being solely inpatient to outpatient, but you're also seeing your inpatient beds full 100% of the time. And so when I think about bringing contingent labor on my inpatient side, I'm thinking about maintaining my brand integrity. What kind of care does this community expect from me? And I have to have the right number of people at the bedside to do that. So it's a constant push-pull that we're doing.
Very well said. Anyone else want to add on to that?
I think she said it very well. I think one thing that I would add is in a rural area, right? It is a little bit of a blessing in disguise. I mean, Penn State University is kind of on our campus, and one would think like you would get a lot of talent out of that. Being in a rural area is interesting because people who are born here and raised here work here. And so that's the blessing aspect of it. And therefore they take care of the patients because they are their family, their friends, their neighbors. Flip side of the coin is it's really hard to attract people into a rural community hospital setting. And it does often, and I think Kimberly said this well, I mean, you have to balance your growth with what your workforce is capable of doing. Contingent workers, yep, I have to focus them on the inpatient. We're experiencing the same thing Kimberly is. We're running at full census. It feels like almost every day, even in the summertime, it seems unreal on the volume piece to it. But certainly the strategic growth on the outside is really looking and leaning into the community health needs assessment. What do we need? What can we provide safely here, confidently here? And then really designing our care around that community health needs. It does often at times, though, come at what services are we providing that are not utilized as much as core services. And so I think our goal is really to provide 90% of the care here within 20 minutes of everyone's home, and then really to partner in the higher end tertiary quaternary, knowing that we're not going to be able to provide it here because providing it here could result in not being able to afford healthcare services here. So we're constantly trying not to destabilize the ecosystem while balancing what we can be for the community.
Couple quick thoughts, River, just that come to mind. I mean, we're a little bit unique in that we do have a hospital and the outpatient settings, which is great for some reasons and tough reasons, but we're a teaching learning hospital. So for us, it's about how do we grow our own talent and train our own talent so that people can stay within our integrated health system and we don't have to rely so much on the market. And that's a real tough thing to do. But some things we've had to look at are, can people be in multiple jobs? Can you train so that you can work in a couple different areas, because different generations want different flexibility and ability to work in different areas. So that represents and creates a challenge that we've been trying to work on for a couple of years, and we're about to roll something out, which is exciting. But those are the types of things you have to think about to say, how do we adapt to what is happening in the workforce and what the needs of different people have, and how do you support the demand and the growth of the organization. So I think you kind of have to do it all. And the only other thing I'd say is you can't do that well if you don't have really great operational and finance processes and clarity in place around staffing models and who needs what when. So all those things have to work in coordination together. So it does require a lot of collaboration between all parts of the business in order to make it successful, which can be challenging.
Thank you, Andy. Thinking through all of that, I mean, so well said again by the three of you, right? I love hearing local is best, right? With strategy around bringing that where you need it to be in care, thinking through, right, how we're using, right, hearing each of you, that community health needs assessment, and then really the reality, right? I think Kimberly, you said this, right, of how many techs, right, are within your ability to even generate that within your communities. All well, Andy, you building upon how does modeling allow for you to create building your own, knowing, right, hearing the amount of demand and the work you're doing. This one, right, starting with you, Susan, and the work you all are doing with Wilson Medical Center, right, as we balance all of these things for growth, capacity, right, having to look at today what reimbursement models are, how they're evolving. How are you all looking at scale, or shared, right, scale in purchasing, some of those partnerships that are needed, while remaining sustainable, and then where does it balance for you in looking at those long-term, needs for investments for your organization and mission as well?
Sure. I'd say that we're being really intentional about that. We're right now in the middle of our strategic planning. So looking at, what capabilities do we need to own, and where can we partner, or what can we share across our larger system because of how we're structured. So I think workforce, of course, is a perfect example. So if I'm evaluating an investment in additional staffing, I'm not always just looking at the salary expense. I'm also looking at what the position enables, right? Does it reduce my premium labor? Does it increase procedural capacity? It's so funny. I just had one of our specialists visit me just yesterday and telling me about these great procedures that he wants to start next month. And so making sure that I've got, the education in place, we've got the preference cards, the supplies, and that our folks are ready, and that we've got enough techs and circulators to be able to support that business. So again, it's really looking at all those pieces and making sure that they make sense, being intentional around that, making sure that I'm including my leadership, directors of those specific service lines, and having that conversation. Okay, how many do we have now, and what do we need to have in the future in order to support some of our growth plans, and looking at that and being just really specific, and then being able to take that message and share it with our division and executive VPs to obtain their buy-in on some of our strategies and how we plan to grow really. And so it's really looking at all those pieces and putting it together and really being inclusive and having those conversations, of course, both locally as well as within different levels of the company.
Thank you, Susan.
Sure.
I would say that right now, healthcare organizations are having to be brave. We historically, a couple of years ago, we chose a partner to do an ACO with, an accountable care organization with. And honestly, they didn't meet our expectations, and they didn't meet the needs of our growing community and evolving community and the way things are changing. And so we've decided we're going to take that on because we have a very, very talented team. And are we a little scared? We are a little scared. But what keeps us grounded in it is we know we deliver exceptional healthcare here. And we have to remove barriers and ways for patients to get into our organization. And so we're all throwing it in and grabbing each other's hands and saying that the time is now, we have to do it.
So well
Yeah.
said.
And Kim, what I would add on to that is not only brave, but healthcare organizations have to contingency plan. I mean, you have to have a plan, first of all, and then you have to have contingency plans. With HR1, we're a little bit unique in that we're one of the only organizations outside of the state that enrolls people in Medicaid, Medicare. So with the changes coming, we're having to invest in more staff to learn and support the enrollment changes and the requirements to remain enrolled in those programs. And for us, that's a critical revenue stream. So if we don't do that, then we're putting ourselves at risk of having a dip in our financials. The other two areas I would just say that are key investments for us are strategy office, because of what I just said. You have to have, I think, a lot of clear strategy on growth and how we're going to shift and adapt with some of the changes that might be coming. And then our payer contracting, because of the reimbursement models. And you've got to have the right talent in your organizations to manage all of that and manage what's changing about it. So I think those are the three areas that are kind of top of mind for us related to that question.
I think it's also certainly accelerating the need for integration, especially for those that are kind of ambulatory and inpatient as well, where we have the redundancies. This year we have felt certainly reimbursement perhaps harder than past years, but I would say we're going to have to think differently about how facile we can move staff around, right? How do we level load based on volume? It's actually not a skill set. It's not something that Epic has native in it or that Oracle naturally does. We've been spending a great deal of time of looking at, provider staffing ratios, benchmarks. What does it tell you? It tells you where you are related to median. It doesn't necessarily tell you as to whether or not you're properly staffed or overstaffed. And so that introduces the next concept of, well, how do we look at our labor utilization piece? I think we're kind of dipping our toe into that. Andy may have more on that, but really starting to staff based on volume in areas, the emphasis for cross-training, right? Or developing staff in-house, right? To be able to move, with volume. And again, I would be overspeaking if I said, yeah, I knew how to figure that out. What I do know is that in order to reduce the labor costs, I'm going to have to get a lot more sophisticated in how we manage the day-to-day, and it has to be more timely, than on an annual review. So, just some food for thought there.
Such good thoughts again. Just kind of thinking, right, be brave. I think that's probably for everyone right now, and the shifts, right? Hearing, right, Susan, planning, right, starting with local, how to bring others in, and then how does that get socialized while being strategic? I think Andy, right, on having plans for plans, right? And Don, data, what is data, right? How do we benchmark that, and thinking about what does that actually mean for us to continue to think, and maybe building again on thinking through all these tools, right? These strategies that we're thinking about, hearing multifaceted. Andy, knowing some of the work you're doing there with Denver Health, when you all look at, what tools, where those data sources come from, where do you gather those workforce insights, right, to make these strategic decisions? How accessible, right, and how actionable is that information when you need it? And have you found differentiations in where you found different tools and or systems that are helping Denver Health faster?
Yeah, I think it's one of the most important things, and I think it's one of the most challenging things given what's happening with technology. 3 years ago, we were at an HR system where I couldn't tell you what our turnover was, and we didn't have access to any data. And today, we have access to every data point you want, but not necessarily the information associated with what to do with that data. So we're in an environment, and then with AI, you're in an environment where you can access data quickly. So the term kind of data rich, but information poor. So you have to figure out, again, from a talent perspective, how are you skilling people up and training folks to leverage and use the data that's available to make those timely decisions. And I mentioned the Pecan dashboard is great because AI is built into it and it gives real timely information and feedback. It also has attrition risk data built into it that's AI driven, but that's one tool and that's one piece of a puzzle when you need to put all the data elements together that help tell the story. So I think that's the challenge is, how do you then go build a dashboard for your leaders so they can connect engagement to turnover to feedback and performance and skills to make an informed talent decision. And I don't have the solution. I mean, I think the other challenge with it is what do you need at the executive level, the middle management level, and the frontline leader level to make the decisions needed at each of those levels. So I think the key is that your organization is and you're developing your talent and your people to help you figure out how to work quickly and respond to the data that you do have to help drive all the things we're talking about around retention and engagement.
Yeah, I would agree with that. And again, if you focus back on the 5 generations that we're talking about, we touched upon scheduling and benefits being across, 5 generations. But also when you think about your turnover in 1 to 2 years, 2 to 3 years, 3 to 4 years, people that are leaving your organization at 1 to 2 years, it's for entirely different reasons than it was 10 years ago. And so you're really having to dig into that amount of time that people are staying in your organization and saying what's making people feel safe here. We invest a lot in the orientation of our staff. We thought we had I will tell you, we thought we had the keys to the test, when in fact we do not have the keys to the test. We have a massive problem in that 1 to 2 year because we have an experienced to inexperienced mismatch. So you can orient those people all the way to the bank, but if they don't have somebody that they can ask a simple question to when they don't feel good about what they're doing, they begin to look for other opportunities.
We've also created an interesting phenomenon, right? The sign-on bonus. The sign-on bonus as a form of retention. And that created a whole sub-workforce of people who like to work at organizations for 2 years. It also created, right, another phenomena, which is we're not retaining our own staff with retention bonuses. And this is this kind of new, right? We thought we were doing the right thing. It felt like a great strategy at the time, and it worked for the first 2 years. What I'm starting to notice, though, is that now there's a whole workforce that relies and are happy to migrate every 2 years. I'm also starting to see the negative impact that it's having on the workforce who is long tenured, right? Which is now going to cause us, and Andy's probably like, well, yes, you should have more of a tenured bonus. But yeah, you could see the shift, but it's also interesting in the work lifestyle balance and then the bonus. There's a very transient workforce now as a result of incentives. It's fascinating.
Yeah.
Yeah, you're absolutely right. I would say we're always battling with that. And then, your competitors down the street, they up the bonus or the sign-on bonus a couple dollars, and then you're out of the game again, and having to keep ratcheting it up. And then making sure that you're not hiring in a lot of your new talent in at a rate that's higher than the ones that have been there, and, for years, your tenured staff, and continuing to monitor that so that you don't have that compression, because that will create problems and some dissatisfaction, and we don't want those folks walking out of the door on us. We want to make sure that we're doing all that we can to, I guess you could say, re-recruit those that have been there for multiple years and have served, especially through your COVID years, and which was some hard times. So definitely, yes.
So such good insights again, thinking through all of this data that is accessible, how to pick and choose or to iterate on which systems, the generational components, right, of your workforce, and love to hear, right, as you all highlight, right, not only those coming in, but how are we keeping those that are here, and the components, right, of where they at and how they come to work every day. Building on this, right, maybe starting with you, Dawn, and thinking through at Mount Nittany, and for each of you, right, the regional health systems, right, and the importance, right, I think I've heard each of you call out the focus of both those working there as well as the importance to the community. What are maybe one and or two, do you think, of the biggest opportunities and or at time mistakes, thinking through how you might think about those biggest decisions that you're going to make as a health system regionally, and or opportunities of making decisions differently, starting with you, Dawn?
Yeah, I mean, I think our biggest asset is that our people are part of our strategic plan, right? It's one of the pillars. And so every decision that we make, whether it's, strategic or operational or, regional, right? It all has to cross through the pillar of people. And so with that being in mind, I think when we look at really the next 2 years of what's to come, I think very similar to Kimberly, we're looking at an aging population. But at the same time, we're also looking at a workforce that very much values work-life balance. And we are going to have to find and fine-tune how to be able to deliver on both. I think that I see that as being a forecast of something that we're going to have to be intentional, because at the same time, we have the strong desire to reduce labor cost while increasing technology, while we have an aging, patient population and a workforce that wants work-life balance. So I say that because I feel like all of those influencing, it's multifactorial, but we're going to have to find the balance of how to still provide healthcare in a way that people feel heard and taken care of, amidst all of that. And then I think that the other thing is recruiting people into that. Our greatest challenge is going to be is that we are seeing that we're winning in the recruitment game by work-life flexibility. So people like to work a 0.6, 0.7, 0.8. Obviously, how I've set up, how we are set up geographically, and perhaps many of my other leaders, I'm actually looking at new ways of building buildings, right, that allow for more of a flexible staffing model and abandon somewhat of the community, hallways that really kind of siloed teams, right? I'm probably going back more to a square model with a gearbox. It's all of these things that we have to think through, as we get into the ebb and flow of workforce. But I would say that they're probably my core thoughts.
You, Dawn?
If I could add just a little bit too, I'd say as we look at some of the vacancies and not really automatically replacing that vacancy, but really looking at how can we change some of the work that we're doing. As an example, looking at how can we optimize some of the work that we're doing within our network to ensure that we don't have the leakage. Should we be looking at developing the role differently so that we're able to navigate our patients through the process more seamless and be more efficient, and not just doing what we've always done because, you know, it's historically we've had this particular position when it really may not be serving us in the best way that we could really leverage it in today's times.
I think everyone has said this very well, and I know I've focused on systems and data a lot, but I would highlight the fact that I think healthcare is pretty well protected against AI, meaning the people-human connection is not going away in healthcare. And as organizations figure out the roadmap, what we know is going to be necessary is that you've got people that know how to talk to people and can communicate effectively. I think one of the biggest things I see from a waste and an efficiency perspective is most errors inside organizations stem from breakdowns in communication. So if you can do communication training at all levels and focus on how people are working with other people to solve problems and leverage technology, but not lose that human connection, I think that is going to be fundamental to healthcare moving forward, regardless of the changes. And that's where the focus should be.
I'd like to double back on some. Go ahead, Kimberly.
Oh, you go ahead, Dawn.
One thing, critical thinking. So not only communication, but I do worry with all the best practice alerts and all of the fancy things that the people actually stop just looking at the patient, right? And then they're just waiting for an alert. So I apologize, Kimberly.
No, I think you just teed me up so well. So for all the ways I think we're going forward in healthcare, we're also having to backpedal and go back to the basics, right? When you think about, we're an organization that's marching to our 5th magnet designation. We gave our nurses 8 years to go from an associate's degree to a bachelor's degree. Yet we didn't give them a roadmap to do that. Again, I keep going back to this 5 generations. You know, a lot of our nurses that are at the 8-year mark just did not know how to remove the barriers to get that bachelor's degree. And one of my big agenda items is keeping my staff happy by removing those simple barriers, partnering with the local university and making it where it is a simple enroll and you start in your program, right? And so we're taking so many steps forward, but we have to remember what those step forwards cost us and other things, and it's a push-pull that we have to do with our staff, I think.
And if I could just add one little thing, because you mentioned AI, thinking about how we use it to help our clinicians be more efficient with the care of the patient. As an example, in our EDs, you know, being able to leverage some of the AI tools that will help capture a lot of the information while they're visiting with the patient and obtaining information, such that we're giving them that chair to connect, to sit and be able to have that touch point with that patient. You know, that's so important. Andy mentioned about, you know, making sure that we're really having that touch point, and that won't go away because patients will always remember about how you made them feel when you were taking care of them, and they will tell you in their those surveys. They'll give you the feedback so that you can make the changes. But I do think we can leverage it in a way in which it helps us to be more efficient, but not replacing that human touch.
So well said by all of you. I think resonating again, listening, people, right? And not to take away AI in this conversation, but even with AI, how do we empower, how to have the plan? I think listening, right? Critical thinking, not just noise. How are we designing both working together, working differently, to make sure that we're being thoughtful of those that are taking care of the patients. You know, as we come towards the end of our questions here, I think you all said it well around the importance of people. But Kimberly, coming back to you again at Bronson, and for each of you, right, in thinking about the next 3 to 5 years, what are going to be those differentiators in investments around how capable our regional health systems will be, and what will remain to keep you successful, starting with you, Kimberly, at Bronson?
All of my colleagues have said this, but a part of the Bronson management system is leadership development. And I think leadership development all the way down to the front lines. I believe Dawn said that. When we do our leadership development academy, we're doing our leadership development academy. If you look at even how we would do it 5 years ago, it would have been at the director level. Now we're going all the way down to the charge nurse level. Everybody in your organization has to understand the why, has to understand your strategic plan, has to understand what your growth strategies are, have to understand why you've chosen to take certain steps in your labor management, in your productivity management, and they have to understand why you're doing it, how it's deployed. I think it boils down to how we're developing and how we're informing and how we're communicating with those that lead.
Yeah, I couldn't agree more. I think leadership development is our focus. And like I said, specifically around communications, one thing we haven't talked about, but I think change management is critical in that. Things change so fast today, and they have since COVID, that if you don't know how to manage change well inside your organization, and it's hard with a complex organization, then you're going to have setbacks and delays. I think this concept of workforce retention over recruitment, and being crystal clear about why somebody should want to stay at your organization at any level of their career, and really answering that question with kind of radical and crystal clarity is key to an organization's kind of success, and being able to stay focused instead of kind of all over the place with what you're trying to do. So
any others on this one?
I would just add in that, oh, go ahead, Don.
No, you go.
Okay, I would just add in, again, it's really about that retention, and really trying to put things in place, listening to your staff about what are they telling you they'd like to have implemented, what's going to make them stay, and being able to take action on those things. Maybe you're pulling them into the planning of how you move those things forward, and then celebrating those milestones and communicating that across the entire organization, so that they know that you're taking action and that they have been listened to, and that we're moving forward and doing some unique things differently.
And the only thing I would add, because actually they gave you the best answer ever, is how do you keep energizing that so that it stays new and it stays fresh and people stay interested in it? And how do you make it relevant, right? As the next generation comes in, right now it may be work-life balance. Who knows what it'll be in 3 years? But yes, I think we have to every year almost evolve our leadership development. And, maybe it's focused on change management, but you have to almost look at the organization and figure out like where do we need to be in the next 2 or 3 years? And then how do you re-energize everything from development to communication, throughout your organization is going to be critically important.
Love to, again, just so well said, right? Not only the people, right, listening, the engagement. I think, Andy, you bring up a great point around change management, but the focus on leadership development, and not just doing that at a director level, right? We know with workforce changes, right, the engagement, the ability to focus there early and train and teach, right, to sustain that culture and the mission you all are leading. Looking to a few of our audience questions here that have come in, and maybe any of you jump in on this one. As you think of looking at efficient workforce management in the surgical and procedural areas, having a lot more complexity within staffing models mix, and or looking at some of the needs around dedicated OR teams, maybe CVOR or trauma and all on-call requirements. How how are each and or any of you looking at that to create sustainability, and especially looking at knowing the community needs and the assessment there? I'll open that up to the group.
I would, if I could jump in, I'd say I'm right in the middle of doing that and pulling my leaders along at the same time and kind of challenging them when they say, I need X amount of these particular skill sets in order to run my OR, if you will, and pushing back a little bit and saying, well, wait a minute, why do we need so many? And having them be able to explain, well, because this particular procedure takes this amount of time. And if I want to run more than, X amount of rooms and expand it and run the OR optimal, at its highest level of optimization, then this is what I need in place in order to run them all consecutively at the same time and have a very efficient run OR. And so then you're like, oh, okay, then you get it, the non-clinical administrator gets in and is able to advocate for that leader in order to make improvements, in order to support our growth plans, in order to allow us to scale, in order to support new proceduralists that we're bringing on this year. As well as looking at what's next on the horizon and the types of procedures and things that they'd like to do. So I think it's really, again, pulling that leader, having that conversation and really looking at it very intentionally and being able to communicate that so that we're not just, adding some additional FTEs and not really setting it up for success so that we could run it at its highest level.
Yeah, and I'll add, we do 27,000 surgeries on a 21 OR platform. And so we're truly tertiary. So we're the region's only level 1 trauma center. And so we have had to really do some out of the box thinking as it relates to call schedules, as it relates to how are we incentivizing, to Dawn and Andy's point about cross training, how are we incentivizing staff that can scrub not just a general, but then pivot and scrub a neuro, or the opposite way around, can scrub a neuro and then can scrub a trauma, but because the staff recognize the fact that if you can do neuro and trauma, that you're a unicorn. And so you have to reward them like they're a unicorn, while also getting them out of the OR for their golf league every Tuesday. So you have to make sure that you create the work-life balance, right? And so we've done some really comprehensive work around weekend scheduling, what the call demand is, because that's very important. And, we've been very, very successful in a complex OR, layering things on. And honestly, it hasn't really cost us that much more when you think about how you're leveling the playing field by creating efficiency.
Very well said.
Yeah, well said. I would just add on, I think it feels like we're kind of constantly trying new things and seeing what will work. And I think what makes it hard is when you make a change in a staffing or an on-call or in one area, it impacts the other area. So you just have to be really mindful of when you make a change, what's the downstream impact, and have you thought through all the things you're trying and how that might impact people doing the work. So all just needs to be handled very delicately and with great intention. And I think we're in an environment where you have to be nimble and ready to respond and flex and try different things.
And I would also adding in that listening piece too, so that you're bringing the staff along with you as you're making a lot of changes. We're going through that now and trying some different things to try to optimize, our call burden, trying to optimize, making sure that folks are getting their lunch breaks and things of that nature. So definitely providing the change, but also listening to how that change is going and then making the additional tweaks to make it work more efficiently.
Susan. Well, as we come to the end of time here, couldn't be more thankful. So really honored to have the insights, right? You, Susan, Dawn, Kimberly, and Andy have brought forward, and such good themes, right? To think about the opportunities of both where there's synergies and similar challenges all of us are solving, but at the same time, the focus of bringing that back to the communities each of you are serving in, and really at the same time, the people that are both delivering that care and the patients that are receiving that care on a day-to-day basis. Could not be more thankful to be a partner in this conversation, and I will turn it back over to Marilia.
Thank you so much, everyone. And as River said, we had some great insights and some great life lessons. I would also like to inform the audience that the survey will pop out on your screen is for Marcus Evans to know what other webinars would you like to create for you. On behalf of AMN Healthcare, Marcus Evans, thank you for joining, and we do hope you'll be joining next time. Thank you, everyone.